Hi, everyone. Welcome back to What Happens in Vegas. I'm your host, Dr. Stephanie Canestraro, and today we have an amazing guest, Dr. Prudence Hall. She is a renowned surgeon, gynecological surgeon turned integrative specialist, and she's helping you take care of your hormones. You're specializing in menopause, but you're diving into the gut and everything that we talk about all the time to help heal those foundations. But then you're doing the powerful work with the hormones. So thank you so much for being here.
Oh, delighted, Stephanie. Absolutely delighted.
So what got you and how did you end up going from being a surgeon to creating this integrative practice that you're doing now? And like, just dive into how you made that switch because I find it amazing.
Well, I did my residency in gynecology and obstetrics, and it was primarily a surgical obstetrical residency. And we had a menopause clinic that we would go to at various times. And I thought I was at the top of my game, and I was in many ways. But when I came out into private practice, I realized that I didn't know how to handle menopause. Women were coming back to me crying, nothing's working. Oh my God, is this all you have? And I actually had a bit of a crisis where I thought, should I really be a gynecologist if I can't handle half of the women that I'm seeing? So I went into a search mode and I searched throughout Europe. I had been traveling back and forth to Europe at the time, they were using bioidentical hormones. I was using Premarin, which is the pregnant mare's urine. That was really the only thing available. And it was a wake up. And I started donating a lot of time just to research and to understand what happens to women as early as 35.
Mhm.
Like 39. It became just a lifelong passion because I saw women wake up. It's like
Mhm.
they were anxious and asleep and, out of their minds kind of, and they just came back to center and to full functionality. And I just was hooked with that result. I had never seen anything like that kind of result with surgery. And I mean, delivering a baby, yes, that's a beautiful full result, having that baby there. But this
Mhm.
was very high up there on the totem pole too.
Yeah. So are you talking about in general the bioidentical hormones, like when you started really diving into using those properly? So can
Yes,
you
that was
maybe
in,
explain to people, because you said the Premarin is the pregnant mare's urine is where they get it from, correct?
yes, yes,
Yeah.
correct.
So, and then the estrogen, where is that coming from when you're
So
doing
one of the
bioidentical?
components of Premarin is our own estradiol. My estradiol is the same as yours, is the same as other women's. And
Mhm.
so women got a little bit of relief from that, but they told me their sex drive wasn't improved. They were still very tired. So many other symptoms persisted. And
Mhm.
so I came back from France and had bioidentical hormones. And those are exactly the same hormones that women's bodies make, that my body makes, your body makes, and molecule per molecule.
Mhm.
There's no difference at all. Whereas with Primin, there are 35 different hormones, and some of them are horse. A lot of people are intolerant to horses, allergic to horses.
Mhm.
That was actually more of a pro-inflammatory hormone, even though there were benefits. There was not increased breast cancer with just the Premarin alone, but it just didn't it wasn't as anti-inflammatory as the bioidentical, exactly the same hormones that I have, you have.
Mhm.
So placing those were just basically turning back the clock to a more youthful, better regulated time in the body where the body functioned better.
So when you're using bioidenticals, for example, so I'm not using bioidenticals and I've never taken them. I've had one experience and it was a negative for me, but it wasn't guided. So, was advised, like, just loosely, not with someone who's my practitioner, to take like progesterone. And I took progesterone in like from a natural source, like it was, I think, from Designs for Health. I took it and immediately got my period. So, like, obviously it wasn't the right thing for me when it was like I took it on day 14 and then on day 15 I got my period, which didn't really make sense to me. So obviously it wasn't the right thing for me. So, like, are you mapping people's hormones and then really like just matching what they exactly need, or like kind of what goes into it in that sense?
So first of all, everything is highly individualized. And to
Yes.
give, depending on where you were in that phase of declining estrogen, progesterone, testosterone, and that's what perimenopause and menopause is. It's when the levels that we were used to reach as more younger, up to 35-year-old women, it starts to decline. So progesterone blocks estrogen. So women can have really a bad problem with progesterone if their estrogen is already lower, and then we're blocking it more with progesterone. So the side effects of progesterone are irritability, PMS symptoms, hunger, weight gain, fatigue. So those are all the side effects. Did you have some of those side effects when you were on progesterone?
It
Bloating.
was literally one day, and it was like, oh, yeah, I was so sore and, like, I felt so full, like, everything just, like, filled up, and then it's like my body just, like, detoxed it, like, by getting my period, and then I felt, like, completely fine, and then I never went near it again, but then I started mapping my actual hormones with that Mira app where you pee on the stick every single day and it maps it, and, like, I already had a really strong progesterone reaction, so it was just the wrong thing for me you know? So but, like, for me, it's more like estrogen dominance, which is not as, like, typical, I guess, for people my age because I am over 40 now, but, um, you can go into that, but yeah, mine is, yeah, like, I don't know, because I look at a lot of people's hormones right now these days, even younger than me, and they look, like, so much more bottomed out, where mine looks like almost too much, you know?
Right, I understand that. So as women, so there are a couple of questions here that I can address. It's
Yeah, sorry,
highly
I kind of just gave you a
Oh, no,
little
no,
air.
let's just go. Let's go for it, Stephanie. I love
Yeah.
your question. I want to track right with you. So, Stephanie, it's highly individualized. And when women come in for their first visit for me, I've looked at every hormonal system in the body, the thyroid, the ovaries, the pituitary, the adrenal gland, the skin hormones, everything, the sugar, pancreas, insulin hormone. So I have everything right there. And I can determine what's going on with their hormones. I mean, just in a glance, it's so easy now for 4 decades. So and then everybody has a different tolerance and everybody has a lot of my patients are very sensitive, so they can't take a normal standard dose. And this is the
Mhm,
difference between functional medicine and
mhm,
traditional Western medicine, which can
mhm.
excel in I mean, we're great with acute problems. And look, we've
Yes.
have solutions for melanoma that never existed and for HIV and for hepatitis
Yep.
C. Really, hats off to the innovative pharmaceutical companies. But in terms of just managing this kind of a problem, it has to be highly individualized. It can't just be one size fits all or two sizes fit all, maybe. Everyone's unique.
I totally agree. So that's amazing. So you're looking at all the hormones, not just the sex hormones, and going straight into the bioidenticals. Because I've been hearing so much too about, I don't know, I feel like so many women, and I get how testosterone's important, but like people wanting their testosterone like over 100, and like, don't you stop making testosterone if you're taking too much exogenous? What are the little nuances here that like people are missing with like hormone therapy?
So, testosterone therapy is extremely important for women. And I have a plea out there for the FDA to now approve it for women because we're using it off label, anyone who's using testosterone for women. So, what does it do? It builds our muscle mass. That is one of the parameters of aging, youthful bioparameters or bio of aging. So it builds our bones. It really builds our bones along with estrogen. That's the gold standard for bone density along with exercise. It causes directional thinking. So we get less anxious, we feel more confidence. It runs our sex drive along with estradiol. So women become frightened. They'll tell me, well, I don't want to drive the car anymore in the freeways. Malls might be dangerous. Well, maybe, but that's a very typical kind of fear that women can have being in crowds and not knowing people and being out of control. And I think that it's just such an important hormone to give us the confidence we need, the sex drive we need to create important relationships in our lives. And certainly it does help to prevent scattered thinking and ADH kinds of thoughts. Uh, so that's a very important hormone. I prescribe it for most women. My standard reference range it depends on what country I'm dealing with, of course, but in the United States, it's about 50 to 100. And more and more, I'm using injectable testosterone for women that they inject once every 2 weeks or every week, and it gives a good level, and there's not a problem of it breaking down into dihydrotestosterone, which is a metabolite. So testosterone breaks down estrogen, estradiol, and dihydrotestosterone. So I would say the main problem with women and testosterone is it could, if not monitored, cause hair thinning or hair loss, occasionally acne, occasionally facial hair. But the benefits are so enormous when correctly prescribed that I've been doing this for years. I would say now for 3 decades, I've been prescribing it.
Wow. Okay. Yeah, no, I mean, I know it's important and all of those things I totally agree with. I just thought maybe like from what I was seeing with people, it was almost like being overused, but maybe not in your
Mm.
case when you're actually testing it. Like I guess most of them are all testing it, but I mean, maybe for me, because my body like, do you go into the genetics? Because I have the preference where my body does make testosterone, like, like that's what a preference I have. But again, like, I think from all the toxicity out of my body, usually people's hormones deplete and mine just were like too much. It's like my liver couldn't process them, that they're like, I don't know. I still try and figure it out, but I should probably work with you to really dive into it anyway.
Well, you're right. Everything is detoxified at the level of the liver. And there are all kinds of uniquenesses that we have in terms of what pathway do things go down. So I don't use the reference ranges that the lab gives because there's
Hmm.
so many sick people involved in that. And women on
Yes.
the birth control pill, I've measured hundreds and hundreds and thousands probably of women on the birth control pill, and their T levels, their testosterone levels are very low and they're part of the normal. And also, anyone in menopause is going to have a decreased, well, not everyone, but many women in menopause
Yeah.
have a decreased testosterone level, and they're included in the normals. So the lab, depending on what country, what lab, generally it's about 4 to about 45 as a reference range. So when I'm doing it, I'm looking for results and bone density and muscle mass and, everything, sex drive. And so symptoms count in terms of this. In my reference range is 50 to 100, 125. The patients I take care of are not bodybuilders. They are not trying to get super physiologic levels. They just want to maintain their physical structure, their posture, their lives, and not become really anxious.
Yeah, and I know that MDs are taught that, like, estrogen, if you don't start taking it while you're in, like, menopause, like, early, that it's dangerous or can cause, like, breast cancer, and I know that there's, like, a big call to, like, renege that because like, estrogen used properly actually protects from all of those things, correct?
Yes. So
Um
yes, I was on a TV show, yeah, Fox, for
uh yeah.
and talking about the black label box that had been removed from estrogen and from progesterone. And it said a week ago, it said it increases heart disease, dementia, diabetes, all kinds of different things, breast cancer. And they took those warnings off now. I think
Mm,
that breast cancer is a little bit of a step risk,
yeah.
and it basically analyzed with the Premarin. And there was a statistically decrease in Premarin. And some of the studies show that per 1,000 women, there was one extra woman who might develop breast cancer. But it's all, how is it prescribed? How is it balanced? What is the ratios? And what are we doing with the rest of our health?
Yeah, okay, okay, if someone's already in menopause, right?
Uh-huh.
And that they have been for years. Is it still safe for them to right, when you measure them and you put them on something, is it still safe to do that, to do hormone replacement when you're already in menopause?
So the ideal time to balance your hormones is when the hormones start to become less optimal. So that's the
Mhm.
ideal time. Be at 35, 41, 42. You don't have to wait until your last period is done. So most women will come to me and they're still having their periods. Or many women will come to me and they're still having regular periods, but they are deep in menopause. I'm looking at this hormone called the follicle stimulating hormone, which is a pituitary hormone. And they say, oh, I can't possibly be in menopause. Although I feel like I am, crying and just, oh, terrible symptoms because I still have my periods. No, no, no. You're deep in menopause and the body just takes a while to wind down. Now, there is some data, Stephanie, that you're referring to that says that if you start it more than 5 to 7 years after menopause, that the brain hormones and the neural regeneration and prevention of dementia is less. And the guidelines currently is that if you get if it's more than 5 to 7 years, that there might be more side effects. Now, I have not personally seen that in my
Okay.
practice, like more than, 40,000 women. I see that the memory improves. Women come to a lot saying, I just don't know how to remember what I used to remember and do what I used to do. So I see memory improve, weight ratios to muscles to fat improves, visceral fat decreases. I see improvements on every level, including patients who are struggling with prediabetes or high sugar damage in their body. So my oldest patient is 90. My youngest patient is probably about, well, women on the birth control pill come to me a lot because a lot of them feel so badly on the birth control pill. And that's because their estradiol levels are 5, 10, 15, rather than 150 to 200 to 225. So, I go by symptoms and I always measure levels. And when you said, well, most people measure levels, Tiffany, my experience is that most gynecologists do not measure levels. And I
No.
think that that's to measure levels. How are we doing? How are we going to have a reference point? How are we going to know if
Mhm.
depression comes from low thyroid, stress, low estrogen, low testosterone, high
Yeah.
sugar levels in our body?
y-
So
Yeah.
I
Yeah.
am a big advocate of measuring however we want to measure them. And there are many different ways
Mhm.
to measure.
In your opinion, like, are people hitting menopause or perimenopause earlier? Because, like, sometimes I'm seeing things on, like, Instagram, and everyone is talking about perimenopause, and they're, like, 30 or 20 something sometimes. They're like, "Is this perimenopause?" And I'm like, "Is it your toxic load?" Because, like, all of these things can create those similar symptoms, or even for myself, like, I had severe Lyme disease. So if you look at my symptoms, right? And I was getting gaslit because that's what happens when people don't understand a disease. And, I think it's hormonal. And then you test my hormones and it was fine. This was before I knew more at the time. And, I was in my 20s and when this all first turned on, but I had all the symptoms that maybe you would even put into this bucket of like perimenopause, but really it was infection. So like, are we just hitting the point where also where our body needs like cleaned out? And I saw, some of the stuff where you are doing parasitic load and you are doing heavy metals and all of those things that can make our hormones go wonky themselves, right?
That's absolutely correct, Stephanie.
Hmm.
Absolutely correct. There still is a strong correlation between where the estrogen level is and what treatments need to be done. But
Hmm.
I think taking away toxicity is very, very important. And adding hormones is also it's part of your
Hmm.
operating system, and you want to make sure that it works well. So yeah, you have to look at the underlying causes. So the basis of functional medicine is that we're now in a state in terms of our development in our medical era where it's not just one disease and one treatment. There are multiple causes, as in heart disease, like stress and inflammation and high cholesterol, high ApoB and LP little a. Those are the subsets of cholesterol and, food and exercise. So there are multiple causes of diseases, just like there's multiple causes of the symptoms that you had. And you definitely want to look at them. And we can be quite complex or quite simple, kind of depending on where we you had multiple things going on with you. Lyme disease is, like, very bad.
It's terrible.
So we do not want to mistake perimenopause for Lyme disease. So these
Mm-mm.
panel viruses are very helpful.
Yeah. So, you have anxiety, you have tachycardia, heart palpitations, like, people
Yes.
tie that in. And yeah. So, like, I mean, I had to get Bell's palsy for them to take me seriously. And this is when I knew nothing. Right. So, yeah, it
So
was wild. And I was losing hair. So then they were like, like, anyways, multiple system damage. And then that affects your hormones. So I probably am at a place where I would benefit from, like I said, working with someone like yourself, where I can actually start to like build those things up because I've gotten surpassed a lot with what I have at my fingertips. And I know that, I just started diving into the peptides and they really helped me. And I know that the hormones could. And like, I mean, even vitamin D is considered a hormone. That was a game changer for me. Like I had severe cramping until my vitamin D level got normal, like during my period ovulation. Like, so like I know the importance and it's just a matter of, and I use things like melatonin, which, but I have like I've very little seldom used hormones. I send them to other people and I do see the crazy changes, or it makes that easier for us to detox them because then they're having, that support for that system. And then it builds up strength in the body that you can handle all these things, right?
very wise
Do
set
you
of
do
statement.
do you do precursor hormone too, like pregnenolone and DHEA, like, or
Mhm.
yeah, you're
Absolutely.
of course. Yeah.
pregnenolone, some other hormone, and if there's a deficiency for other things like estrogen or testosterone, it can break down into really all the different hormones. Very frequently, it breaks down into cortisol. We call it the cortisol steal because when we're stressed in the body, first of all, has high levels of cortisol and other hormones. There are about 17 different metabolites of these hormones. Then pregnenolone is there, like mother, giving us cortisol so we don't
Mhm.
collapse. Yeah, stress is very damaging to the body and a core root cause of many, many diseases.
Yeah. And then when you have diseases like Lyme or other hidden infections or lots of heavy metals, your body makes more cortisol just trying to clean up. So,
And
you
choice.
have the mental stress that we all have, and then we have all of that. And then we're just in this breakdown kind of phase all the time.
Yes,
So you're you see men as well though, too,
I
I
do.
saw.
I started seeing men about 20 years ago. I went to Dr. Abraham Morgan's a big conference on testosterone, and he was saying, "Oh, Prudence, testosterone for men is pretty darned easy." So I don't do urology. I make sure that they have a urologist, and if they've had prostate cancer, I make sure that their oncologist approves of testosterone, and hopefully they'll prescribe it for them because men really do need their testosterone. It is one of the major ways to prevent neurodegenerative decline. And this comes from Dr. Dale Bredesen, who's just a luminary in the field of research and brain function and prevention of Alzheimer's disease. So it's very important for men. It's important in terms of their sexual aspects, their erections, their libido, their bone density, their muscle building. So yeah, that's the
Yeah.
equivalent to our estradiol, testosterone and
Yeah.
estrogen.
Yeah. So you don't do gynecological surgery anymore though?
I stopped doing that. There
Yeah.
are so many good surgeons out there,
Mhm.
Stephanie, in my field, and they enjoyed surgery, but I realized that there was a heartfelt need and rather a desperate need back in the
Yeah.
80s, 90s,
Yeah.
even in even up until about, I would say, the hormone field tipped maybe 5 to 7 years ago, where people started to say, "Oh my gosh, this is important. This is not cancer and disease promoting. It prevents all of these diseases." So I really have devoted my practice pretty exclusively to that, and my
Mm.
daughter's a naturopathic doctor who does a lot of the other aspects of functional health, which I love
Wow.
to do. I just don't have as much time for it.
Yeah, no, that's amazing. You guys have your little team that
Yeah, you need it.
just
We need it.
complements you need a team, 100%. I mean, how in the last 5 years, more complex patient cases have gotten, and even what I went through again, because my original Lyme disease was in 2010, but then again, then you get exposed to COVID and, novel EMFs that affect your body and like people that were just kind of at a cusp. It just brings you over and there's lots of chronic issues going on. I wanted to touch on like mast cell activation stuff and then the use of like estrogen because I know that like some mast cell people can like highly react to estrogen because it does bring the
Yes.
histamine up a little bit. Have you seen that at all? Or like, I know you're doing way different and you're microdosing or you're doing just what people need, but like, do you have experience with people who come to you to fix maybe, oh, I did this and it turned on all of these symptoms? Like, do you have anything?
4 or 5 patients who have a mast cell syndrome, one who has a very, very severe mast cell syndrome. She weighs 85 pounds and just cannot rebuild herself, and she's doing fine on hormones.
Yeah.
Um, I realize over the time that I've taken care of these patients is that they're highly sensitive to
Yes.
almost everything, and
Everything.
I start one hormone at a time rather
Hmm.
than saying start D. And I want to just come back to D3 in a second because you said some important things about that's the sunshine hormone that's made in the skin in the sunshine, and maybe DHEA to start with, and just to see how that works, and then
Hmm.
just slowly build from there. And
Yeah.
they're very aware of the diet and the low histamine diet, and they're
Yeah.
very lifestyle and but when they're in menopause, they suffer greatly, and when they're in
Yes.
perimenopause. So hormones are something that we have had our entire lives. And it's our body's operating system. So when the operating system on our computer starts to, go a little haywire, need to be upgraded, and the same thing with our body. The body doesn't function well. And I do think that balanced hormones are very helpful in every illness and every disease that we're facing. Now, it wouldn't be the correct thing to say, oh, yes, Stephanie, you need hormones. That's going to get rid of your Lyme disease. But balanced hormones gives you, it's anti inflammatory and it gives
Mhm,
you more energy and more, it lowers your sugar levels. The high sugars will cause problems with every single disease.
mhm.
It really, the emerging
100%.
field now is immunometabolism. So it's immunology is a brand new field. It's
Mhm.
just it probably invented, I mean, it's rebooted 5, 7 years ago. So everything is sort of beginning to be looked at through that immunology metabolic lens now. So it's
Yeah.
very interesting what's going on in my field with that.
It is very interesting, and I feel like I've personally felt that feeling, like, when my immune system, so I did a live blood cell when I had, like, at the height of my symptoms, and you could see my white blood cells, which are my immune cells, they were just sitting there. Like, in a healthy live blood cell, you'll see, like, the white blood cells reaching in to kinda clean up the cells, and my white blood cells were sitting there just paralyzed, right? While all of this, there was mold beside it, there was E. coli, there was parasites swimming around, and it was just sitting there. There was even stuff inside my red blood cell, which they could see babesia, which is like a parasite that goes in, like, kinda malarial, and my immune system was sitting there. So just all of this inflammation because, nothing's getting cleaned up, nothing's getting broken down. And then there's the whole balance of your immune system that has to happen. And definitely, I probably could have, benefited through this whole thing from some immune support. I mean, not immune support, hormone support for that immune system because it had just, just, I don't know, destroyed every system in my body. It was
That's true. It's a
just,
downward spiral when we're fighting off a very aggressive virus like Lyme and Babesia. These are
yeah.
pretty severe.
So what are some of the most wait, you said you wanted to go back to something. I don't want to I keep kind of
D3, just you mentioned
yeah.
how important it was and how the cramps went away. D3 it decreases breast cancer, colon cancer, dementia, flus and colds. It builds the immunity. So this is a very important hormone that we can all take, even small amounts, especially during the dark months when we're getting no sun. And with all the sunblock and the ways we're covering our face and skin so it doesn't become blotchy and old, we
Mhm.
do need some D3, and it's over the counter. So it's you want to make sure it has K2 with it, but it's highly effective. So I see why it stopped your cramp. You probably had an underlying inflammation going.
Oh yeah, definitely was the name of the game, but it was so helpful. And I mean, I was taking it and it wasn't getting absorbed. My vitamin D was not changing. It was liposomal vitamin D that was a game changer for me. So, and it had K2 in it and it absorbs under your tongue. And I don't know, that was the thing because I was taking regular, like a oil, but I guess maybe because of my liver or whatever, issues that there was. But a side note on vitamin D3 is that people sometimes think, too much of a good thing, too much of a good thing is a bad thing. So I've had 2 women, it was helping this one lady's headaches. So she was just dosing herself with like 100,000 IUs orally a day. And she had severe vitamin D toxicity. So don't do that. But if you use it as informed, it is very
Measure
safe.
your levels. Measure your levels, just like it's an important hormone. Just like you would measure if you're trying to lose weight, you might measure the amount of protein you're getting or the amount of carbs you're
Hmm.
getting.
Yeah.
The vitamin
See, they
D
make it
precise.
harder here though. In the States, you guys can get blood work so easily. You can test your own blood work. Here, like vitamin D, like they won't test it regularly for people. It's
Mhm.
insane. So, we've found ways around it and there's even like a finger prick now, but it's kind of crazy how much data people don't collect. Like, and I don't understand it really because I know you sound like a data-driven person as well. Obviously
Absolutely.
you are very data driven. So that's like I'm totally on board with that. Do you look at the genetics of the hormones before you do hormone replacement as well, or do you just go based on serum and all of that? Yeah. Or
So
what are you doing to test the hormone?
we're in the area of genes. So one of the things I do, which rather it kind of bypasses the genes, but tells me what's going on, and then tells me, yeah, I did do some genetics on this person, is I look at 24-hour urines. It's called the Meridian Valley, and
Mm.
it looks all the metabolites. So estrogen is broken down into 2-hydroxy, 16-hydroxy estrone, and then into fours and estriols and all kinds of things, hydroxyestriols. So I look at the breakdown and see what's happening. And I say, okay, this person is perfect. I don't think there's a genetic abnormality, but I do genes if it looks like the breakdown, the metabolism is not correct. And I also have a supplement that I made called Estro Protect that has calcium deglucarate and that really blocks some of these aberrant pathways that we don't want. We like the twos. That's good. We don't like
Yeah.
the 16. We don't like the fours.
Yeah.
So we can actually measure estriol correctly, and it looks at all the metabolites of our stress hormones too, and it looks at thyroid. Thyroid,
Amazing.
we should a little bit about thyroid.
Let's do that.
No, if you want to do that or not, but
I would
it's
love to. Let's talk about thyroid because, like, what's going on with that? Everyone's got this sluggish thyroid, antibodies. Like, what's going on with the thyroid? What are you finding?
so I find that about 60 to 70% of women, when they're in menopause or going into menopause, have lowered thyroid hormones. So that would be deficient thyroid hormones. We call this uh, hypothyroid. Sometimes it's necessarily easy to detect these states, but it's detected with symptoms. So the symptoms of low thyroid would be fatigue, brain fog, weight gain, dry skin, hair loss, constipation, depression, bloating. That would be one. So there are all these symptoms that sound like it could be menopause. And the way I determine whether it could be a subtle, or actually a very visible low thyroid is by looking at all the levels. So I look at 5
Uh-huh.
different hormones, including the antibodies. So, Stephanie, antibodies are important because a lot of Hashimoto's is out there. This is where the immunometabolic thing kind of combines and is very important in menopause too, because you do not want to have autoimmunity that starts to hurt your own immune system in your body. That's a hyperactive immune system where the
Uh-huh.
body's rejecting the thyroid gland. The gland's right here. So I use a lot of iodine. I use selenium. Detoxification is very important for the thyroid gland because heavy
Yeah.
metals, fluoride, all of these will decrease thyroid function. And it's one
Uh-huh.
of the hormones I consider a menopausal hormone. It declines as we age.
Yeah, definitely. Yeah, and then the thyroid's always interesting to me because, like, especially in the stages of if there is some of the autoimmunity towards it, because you'll go through phases of like really low thyroid, but then your thyroid gets broken down, so you get surges of hyperthyroid. So people can get really confused, right? When they're having sometimes symptoms of low thyroid and then all of a sudden symptoms of the nervousness, the hyperactivity, the like wired and tired feeling, the like hair breaking, and then they can cycle back into like the fatigue. And it's just like those in between times of when the thyroid gets broken down that they're in the autoimmune on the thyroid, you're actually releasing some of the thyroid hormones. And yeah, so I do think that it is underlooked at. And again, it's hard for us here to get people to do the thyroid antibodies without like them having like severe symptoms. And, we have people with just small symptoms that have like very high thyroid antibodies. So I just think it should be part of a regular panel personally, but I know that maybe
It should
eventually, but
it should be, Stephanie. I hear that the medical system in Canada is actually quite available for people to enter into it. Here, we have whole segments of our population that can't get medical care. They
yeah.
can't afford it. For example, my daughter is paying something like $2,500 for medical care a month for her little family, through her
Yeah.
husband.
No, I know. I know. It's like I know I'm not there's pros and cons to both for sure, but I would love to just be able to pay for something, but that's not available here?
Yes,
So
yes.
it's kind of like it's hard to find the perfect thing because you have to then just accept what they kind of give you because doctors are full here too. And, they also have like 5-10 minutes to spend with you really like, cause they're on this like OHIP system, right? There's not a lot of wiggle room for them either.
And it is so important what you mentioned that doctors are trying to control the patient interaction, and a little bit of control is needed, but it's a collaboration between the doctor and the patient. And I hope that women can ask for different labs that they might need drawn and have a doctor who's receptive to that. And when women talk about symptoms, because I have hair loss, I've gained 20 pounds, I'm depressed, and I'm very constipated and I have dry skin, could we check the thyroid, including the reverse thyroid 3, T3, and the antibodies? Would they do that, Stephanie? Probably some would.
Usually no, not if their rules are pretty much they can do TSH with like free T3, free T4, or sometimes even just TSH, and that has to be abnormal for them to be able to dig deeper, or else
Oh,
they can get flagged and stuff like that. So it's very much missed because of those kind of guidelines. Now, there are doctors that are thinking outside the box, or they're going, you can they can write the requisition and you can pay out of pocket because that's just what will be covered. But they're just not very willing to do that because they do, I think, get frowned upon by their board. So I don't want to speak too much for them, but we do have a hard time getting all the information from the blood work. Yeah.
40% of the time, the TSH will not tell us the status of the thyroid gland. So it's not the diagnosis. Now, the free T3, if our listeners can get a doctor to measure free T3 plus the TSH, that's much more helpful because the free T3 needs to be 3.2 and above. And this is backed by some big icons in my field with lots of research that T3 is extremely important. It's actually 6 times more potent and important in terms of the work that it does than the thyroid 4. So, okay, you don't want to measure, we don't measure the thyroid 4, the T4, just measure the free T.
Yeah,
Even
we kind of say the analogy like, the T4 is like a check, and then the T3 is like the cash that you actually spend. Like you've got to go in and you've got to actually cash the check for it to work. So
that's right.
you need that T3. So when you are giving thyroid hormones then, because I know a lot of people give are you doing sometimes like that armor thyroid where it's like T4, T3 and T4, or like, I guess, what how do you go about that when you have those
Generally,
findings?
generally, I give a T3, T4 combination.
Mhm.
And I use Armor
Mhm.
NP thyroid, is in
Yeah.
no plea thyroid. And also I have a source from New Zealand that is from New Zealand pigs.
Oh,
That's how we
nice.
get T3 thyroid. It's an animal glandular. Those 3 are very, very good. If there is a high reverse T3, that means that the thyroid is being bound up. And then I
Mhm.
use 3 to kind of unbundle it. So there's all kinds of
Okay.
little tips and stuff. But the first trick is just make a diagnosis. Is it okay? Is it hyperfunctioning? Is it low functioning? Does it have a Hashimoto's where it can go up and down and up and down?
Mhm.
And it's
Mhm.
it's it's
There's
well
lots of
worth this.
intricacies. So that's why it is like this one-on-one, like, kind of care that you need with someone that understands this like yourself. So you have a practice, but do you do virtual like for people from all over, or
I have a lot of people from around the world, and I do virtual for these people, and it's a nice medium because I can share the screen with them. I mean, like
Mhm.
right now, just click share the screen, and so I'm saying, "Now here's your FSH, here's your estradiol," and I'm looking at their eyebrows to look for the Hertog sign. Are you losing your
Yeah.
eye? What's happening with your skin? Let me see your body. So
Mhm.
it's helpful because everyone also has a doctor. They have a gynecologist and another doctor that's checking their blood pressure, which is extremely important, and measuring their body fat and all of that. They sort of started in COVID, where the clinic was closed for a year.
Yeah, I'm a chiropractor by trade, but I got really sick obviously in chiropractic college. That's how, and then I went straight into functional medicine
Good.
right after, and then always wanted like a virtual component, but yeah, during COVID, that's when it really kind of happened. So
Well,
since
right.
COVID, have you seen increases in like breast cancer and all that, like in your practice?
I have a very low incidence of breast cancer in my practice. It does happen, but it's a very low incidence. Last time we checked, it was about 1 in 45, even to 1 in 50. So normally it's over the lifetime of a patient, it's about 1 in 7. It's
Yeah, no.
about 4 to 5 per 1,000. So that's less than
Yeah.
that. But it's
No, but
over
me
the life
even
patient.
people coming to you that already have had that diagnosis. I don't mean like, or
With
is
that
that
diagnosis, yes. So I
yeah.
do treat women with hormones who have had breast cancer, but I do it very carefully. I make sure that an oncologist who's a good oncologist approves, and they look at all the markers of the cancer and the size and the location and the activity and how long it's been. And then there are such benefits to hormones that If the oncologist feels that it's safe to use transdermal hormones, then I feel reassured in terms of treating women. A lot of women have come to me for that over the years. I think that this is the next thing that'll tip in terms of my field, that it's okay in judiciously chosen patients to use estrogen for their menopause because estrogen matters. What happens if a woman doesn't take estrogen? She's going to lose her bones, she's going to lose her brain and her muscle mass, and she can become very depressed. And women take to bed. That's something that they used to say in the Midwest. Oh yes, my mother took to bed when I was 12, meaning they just don't get out of bed. They're so exhausted. So the
Yeah.
benefit versus the risk in every patient is analyzed. And
Mhm.
with Morgenthaler, Dr. Morgenthaler, big Harvard father of testosterone therapy, he shared that he was stopped on the campus saying, "You're a disgrace to our field, giving testosterone to men. You are feeding them prostate cancer." And he, through enormous data, showed that that exact opposite is true, that
Wow.
testosterone helps to prevent prostate cancer. You still have to prescribe it safely and judiciously and look at all the risk factors, but that it is now safe to use in many, many cases when men have had prostate cancer. And men probably get prostate cancer in part due to their low testosterone as they age. So, our field will tip. We'll see what happens with it. I'm careful
Yeah.
but at the same time, we have to look at what is happening in front of us and treat that patient who is suffering greatly.
Yes. Yeah. I know. And there's so many nuances. I think that's the important thing and what I try to get across on this podcast in general. It's like, it's such a disservice when there's like a smear campaign on any single thing because uniquely to one person, something can be very, very helpful and life changing, when used properly, and everything can be used improperly. And, even in our practice, like we always try to do as conservative as we can and then but then also be able to share with people different people practicing in different ways that can help you in ways that we cannot. And these are still conservative things, but like, there's a time and a place for everything. And there's been a smear campaign on vitamin D, smear campaign on
Mhm.
melatonin, on hormones, I mean,
It's interesting that a hormone like melatonin, which is anti-inflammatory and it's an antioxidant and it induces sleep compared to, let's say, Ambien, which I'm sure has its
mhm.
uses, but increases dementia. And I think people sleep another 15 minutes a night with Ambien. I don't want to smear that one particularly, but it's
No,
just
I
when you
know.
look at risk versus benefit. Now, pharmaceuticals have done a great job with some of the hormones. They have wonderful bioidentical patches. I use them all the time. And prometrium, we don't have to compound it anymore. We can buy prometrium and micronized progesterone from pharmaceutical industries. They have made big changes in health in terms of prevention. I do a lot of compounded pharmacies too, and use a lot of things that be individualized to that person a little bit more uniquely for sure. But, bioidentical hormones are not, we all know about them now. It is part of our medical treatment and hopefully will become even more so. Some doctors are still very suspicious and don't know how to treat perimenopause, which is important to treat too.
Yeah, no, it is important to treat. So that's where people can reach out and find you. So you take people virtually, like where do people you have a website, you
Yeah.
have an Instagram? Where's the best place for people to find you?
I would go to thehallcenter.com or Dr. Prudence Hall. It's my book called Radiant Again and Forever is
Mhm.
for free. I wrote the book to educate women, and Suzanne Summers begged me to write it. So I kept on saying, "No, Suze, I'm too busy. I'm too busy." And she said, "Write the book. This is what you do. Each chapter, is a different patient coming into your consult room." So the first one's on menopause, and these are real patients. Explain what the symptoms are with that patient, what we did together, how they recovered. And there's a
That's
chapter
amazing.
on everything related to women, including sexuality, breast cancer, perimenopause, PMS, thyroid, adrenal burnout. So it's for free. Just you put in your email and it downloads to your email.
That's amazing. Yeah, everyone should definitely read that. I'm gonna read it myself. Anything that we haven't talked about that you wanna get off your chest or things that you're passionate about right now or that you see going on that, like, we haven't talked about?
Oh, there's so many things. But
Yeah.
this is really helpful, Stephanie, the way you've questioned, and thank you for using yourself is a person that everyone can relate to. We've all had these things happen to us that are really catastrophic in our lives, and trying to figure out how to, untangle all the different etiologies. But
Mhm.
one thing that I frequently say, Stephanie, is that how you handle your menopause will determine the next 30, 40, 50 years of your life. So you really want to make the correct decisions. You don't want to just say, it's dangerous and I won't do any of that. It's kind of like saying, well, you would die if all your hormones disappeared, probably in about 15 to 20 minutes if you just stopped making hormones. So correctly prescribed, and I don't think it's very hard to correctly prescribe them, but correctly prescribed hormones make a huge difference, giving you energy, allowing you to create your purpose in life, allowing you to love more fully and to be less conflicted and afraid and anxious. So I have three sisters, and we have been just wonderfully close friends all of our lives. And I've seen how women can really help each other and be ambassadors for other women, as I am with my sisters and they are with their friends. So I encourage your patients to make sure that their hormones are balanced, and if not, to take the steps needed to optimize their hormones, and then to be an ambassador and to help alleviate the sufferings of others, because there's nothing like being in service to others that brings personal happiness. So I'm a very
Mhm.
happy Stephanie because of that. And we're all part of this solution. It's not
Yeah. That's
me
beautiful.
alone. It's everyone, all of us together that help,
Mhm.
that help.
No, I love that. I love that. That's beautiful. I mean, I think we can end there. I'm sure I could ask you questions all day. I mean, I just am very interested in this topic, so I'm sure we'll meet again, but I really, really appreciate your time and for being here.
My pleasure, Stephanie. This is one of the things I love doing because I'm reaching audiences that are already there, plus all of my audience that is there. And
Mhm.
it's synergizing with other doctors, other practitioners, other functional medicine people. So I love
Mhm.
that. I
I
was
love it too.
trained that it takes a team. Doctors
Yes.
aren't not the kingpin. I'm not the one that it takes a team of people
Mhm.
really help provide the support and the knowledge that's needed.
Yeah, I mean, I love learning from people like yourself, and I do have a profound respect for people also that did actual surgery too, because you've seen the body in a different way and you've had to, I mean, that is stressful. You're literally having to cut a human, like that is like a big responsibility in your hands. So I do always like just, have the utmost respect for that. And then even like I said at the beginning, the kind of transitioning into helping people in a more integrative way because you saw that as a necessity and then to like excel in that. Like I just feel like surgeons have this special gift, like, their precision and preciseness. So I really appreciate that.
Well, Stephanie, we are precise. And one of the things I learned very early in my residency is do not operate unless it is really, really important and necessary. And the idea that, oh yeah, we'll just take out that uterus, that is completely
Yeah.
archaic now. You have to
No.
have very strong indications, and then
Yes.
it's life saving, and then it is an asset. But and I would say that a good surgeon is one that knows and chooses not to operate
Mhm.
more than half the time, three-quarters of the
Mhm.
time.
Mhm.
And yeah, it's a tool. It is
Yeah.
a tool, and
Yeah.
it's crucial.
I've interviewed, well, now yourself, a heart surgeon that's now doing more integrative functional and a brain surgeon all like recently. And yeah, I love the insights. And it's funny because you guys do all kind of really utilize and bring in those powerful like hormones and, because they move the needle and they make big changes. So, I know that I can see the importance. And again, just in our field, we're not able to prescribe those things. Like, so
Right.
we get to lean on people like yourself to utilize them and be the specialist in that. So yeah,
Thank you,
we'll
Stephanie.
definitely be
And we can all
reaching
make a
out.
difference. Yeah, we can
Yeah.
all make a difference. When I look at who has really changed medicine, one man, Dr. Jeff Bland, he has been father and the impetus to create thousands of functional medicine doctors in the United States and around the world. So one person can make an enormous difference. Dale Bredis making an enormous difference in terms of how we approach neurodegenerative decline and Alzheimer's disease and these types of diseases. So each of us within us has that specialty. has that
Yeah.
ability to make someone smile. It
Mhm.
improves their day. We offer support to somebody else. You could have
Yeah.
saved their lives, so it's we're important. Each of us is uniquely gifted with different gifts. So
Yeah. Doctor, Terry Walls is who got me into functional medicine because when I had that Bell's palsy, they told me I had multiple sclerosis. I mean, I had tentative multiple sclerosis because I didn't have 5 plaques, It fits into the little category that they have, but I found her and she was in the Institute for Functional Medicine, so that's how I ended up learning from her, and then obviously that's Jeffrey Bland's thing, so I did do my certification for Institute for Functional Medicine practice.
wonderful. Oh my gosh, Stephanie, wonderful. Well, it's been
Yeah.
so nice talking. Really,
So
just
nice
lovely.
talking to you too. I hope you have an amazing rest of your day, and thank you again for being here.
Thank you.
Take care.